Thank you. So it's 7:02. I'm going to officially wait till 7:03 and honor all of the people that got here on time. Yay. Mary and Chelsea and Portia. Hello,
And
Stella.
next week we don't have class.
No, yeah, correct. Next week we don't have class. We better say that. Hallelujah. Yoo-hoo.
And I'm off next weekend.
Well, there you go. It's all.
Or is it the 26th, Karen?
I thought it was the 26th.
Oh, wait, I'm sorry. We have Sandra Smith coming, the Enneagram expert, next week. Then we're off for
Hey, idiot Graham.
the idiot Graham, right?
Just kidding.
Yeah. So I'm going to go ahead and start because it is 7:03. So welcome to class number 9. Yikes, it's cruising right along. So glad to see you guys. And I think what we'll do is we're just going to check in at something regarding fall tonight. So I'm going to just say that our leaves are on fire here. I think we're in our peak week this week. So it's gorgeous. I have a picture maybe to show you guys when I do some of the slides. So, all right. So, okay, Miss Kelly, what do you want to check in regard to fall?
I'm going to be the harvest moon because I saw one last night.
Oh, harvest moon. Okay. And did you see Jupiter?
I didn't look that long, I don't think.
Okay. There's a big bright star and it's Jupiter. So yeah.
Okay.
All righty. Thank you. And Mary, what about you? What's something fall you want to check in as?
Oh gosh, I think like pumpkin pecan bread. Because
Ooh,
it's so warm and delicious and spicy.
pumpkin pecan bread. That sounds very delicious.
Mhm.
Very
And I did
delicious.
see Jupiter next to the moon. It was so nice. Although when I see the full moon, I dread because I don't know what's gonna happen at the hospital. So it's like, oh, it's a full moon.
Okay. Well, thank you. Okay, Chelsea, what are you in regard to fall tonight?
Well, I don't exactly know how to explain this. We call it crunchy grass when the grass actually starts to get the frost on it. That to me, my kids, we love to find the crunchy grass because that means fall's really here in winter. We are snow people, so we're looking forward to it.
That's awesome. Thank you, Chelsea. And Marcia, what about you?
Say our outdoor fireplace. We spend a lot of time out there before the snow decides to settle in.
Ooh, that sounds good. That sounds good, Marcia. Thank you. And Stella.
Well, I went this past weekend because I felt a little overwhelmed. I went to the farmer's market and realized there were like maybe 15 different types of apples. So I decided to get a few and made apple butter. So I'm going to be apple butter.
Awesome. All right. Awesome. Great. And let's see. I think that's Anne Marie. Who is this? Wait, is this Anne Maria?
Yep.
Okay, Anne Maria. What about you?
Recording in progress.
This weekend was apple picking.
Wait a minute, we got to mute some people. Let's see. Okay, go ahead, Anne Maria. Say that again.
This weekend was apple picking. Since up here in New York we have, various apples, so I enjoy that. But I would like to get the recipe to make apple butter because that's my favorite thing.
Awesome. Thank you. Okay, and Sue, what about you?
I apologize. I didn't hear the question.
We are checking in.
What we did last weekend?
No, we're checking in as something related to fall. Something related to fall. So people have said.
Well, every October is we have like 6 or 7 grandsons and 1 granddaughter. So she's kind of a big deal. And
Okay.
every October is her birthday, and then it's also my husband's birthday. So here we're having a Harry Potter themed party for her. So
Ooh, that sounds fun.
that'll be fun.
All right.
Mhm.
Thank you. Thank you, Sue. And Melody, welcome. We're checking in as something related to fall.
Leaves, colored leaves.
Colorful leaves. Okay. Awesome. Thank you. And Sandy, what about you?
Well, as far as fall goes, we're still waiting for it here.
In South Carolina?
None of the leaves have changed. Yeah. I haven't seen any change yet. But I got some of the fall foliage and things like that. It's nice having a little cooler weather and things calming down a little bit. So then we'll have the holidays coming.
All right. Well, thank you.
I was signed in early, but I had to use my phone. I couldn't bring it up on the computer. I had to restart and blah, blah, blah. So that I was here.
Well, we're glad to see you again. Okay, good. And Mark, what about you?
So an individual I work with at the NC Works office gave me some of these. She brought in a big box of
Pears.
yep. I've got to figure out what to do with them now. So Sunday I stewed an apple, and it was so yummy because I put way too much butter and brown sugar in it. Now I have to figure out what to do with these pears.
Awesome. You can do the same with them, make stewed pears if you want. So awesome.
Poachin wine.
Ooh, poachin wine. Ooh, that sounds good. All right. Well, welcome everyone to class number 9. And just to repeat, next Wednesday, we have Sandra Smith, the national expert on the Enneagram personality structure, talking about the Enneagram. And I need all of your scores. And we got some scores last week, but I thought I would just review that again so I can get everybody's scores. And so I'm just wondering if we can go down the list. And I think Kelly, you were first and you sent me yours. What did you say? You were a 7? Yep. And Chelsea, what
1.
are you? A 1. And Mary, what were you? A 7? I can't remember.
A 2.
A 2. And Marcia, what were you?
A 9.
9. And Melody, what were you? We can come back to you if you want. Oh, you're muted.
I'm an 8.
Okay, wonderful. And Monique, I don't see her here. Okay, and Sandy, what are you?
Well, I was just looking it up. I sent it to, I thought it was gosh, now I can't remember what it was. Okay, let's see. 9.
Okay, thank you. And Stella, what are you?
I'm a 7.
Wonderful. And Sue, what are you?
Another 9.
Another 9. Okay, so I'm just missing Monique, and it's all good. And Mark, what are you? I think, are you a 4? 5, you're a 4, yep. And I'm a 7. Okay, so I'm going to, as soon as we get off the call tonight, I'm going to send them all to Sandra. And she's going to be doing the class for about an hour and a half, and she will speak to all of our types in regard to fear. And the reason that's important because you're going into a private practice as a holistic RN patient advocate. And how many of you all remember the book From Novice to Expert that we all read in the early 70s or 80s? Did anybody read that book?
Oh
So
God.
it's yes, sorry to say, a lot of us oldies can remember it. And it's a book
I
written
think I still
about,
have a copy.
yeah. And so as we remember that, this book was written about a reality shock that new graduates go into when they graduate from nursing school and they go start working in a hospital or any other clinical environment, and how they're shocked by the culture, shocked by the workload, shocked physically, shocked emotionally, shocked everywhere. And they have very poor skill acquisition coming out of a nursing school, and they have to, their self-image and their sense of accomplishment is directly related to how many times they can put an IV in successfully. So a lot of their attention is focused on the skill acquisition. So now there's a book written on and some articles written on going from expert to novice. And when we go from expert to novice, we kind of go through the same thing in that we feel very uncomfortable. There's a lot we don't know. We've been an expert all our lives. And now we have anxiety because we're not the expert. And we are doing other skill acquisition. So just saying, that there's a lot of fear when we start a new profession in this stage of our career. And so she's going to be speaking in addition to just all about the Enneagram personality structure, but all of our types in terms of how we handle fear. So that's fascinating. And it's kind of good to know what is your script you play in your mind when you are faced with something that's new that you don't know how to do. So I find it fascinating. So my whole journey in 7 years of being an RN patient advocate, it's been kind of fearful. But you just say, well, there's some answers and I can learn this and we're going to learn how to do this. And there's always resources. So you as nurses are very resourceful anyway. So you're just going to put your resourceful muscles to work. But so she's going to be talking about fear in relation to all of our types. So that'll be great. All right. Any questions? So next week we're here, which is October 19th. Then on Wednesday, October 26th, we are all out of class. Then on November 2nd, I am flying back from Spain that night, so I won't be here. And Mark will be running the class. And on that night, on the 2nd of November, we are going to have a wonderful guest named Tom Mock, who's the executive director of the SCORE chapter here in Asheville. He's going to give a gigantic overview of the National SCORE website and all the things that they can do for you. And then Mark is going to be doing a bunch of issues, talking about a lot of things related to going into private practice from an IT perspective. Anything you want to add about that, Mark?
I think we'll all have some nuggets of learning there and some comments about what has worked and what hasn't worked, because the online tool sets continue to change and adapt to support what we can do.
Well, thank you, Mark. That's awesome. All righty. So any questions? And then so Mark does the class on November 2nd, then I'll be back, and we have a number of speakers that are going to be here in November, December, and January. So just saying, we have some more fabulous topics coming up. Okay. Any questions about the projected schedule? Okay, so I'm going to share my screen, and here's what we're going to do. Let's see if this is it. Okay, yeah. Okay, so here is a picture of a beautiful, fabulous cathedral in Porto, Spain, which is on the coast of Spain and which is home of the invention of port wine. And this is where Greg was last night. He arrived in Porto, and then he and his friend David will start walking the Portuguese Camino tomorrow. So they are 5 hours ahead of time, and we just get little updates every day. So next time I speak with you next week, I'll have more updates. This is what my back porch looks like because all of our leaves are in the brilliant phase and peak. And also a colleague of mine gave me this quote today, which I thought was really amazing. And the quote is, she didn't know the author was, "My legacy is that I stayed on course from beginning to end because I believed in something inside me." So I just want to say, all of you knew there was something inside you that made you sign up for this course. So I say, yay us. And we can't see, this is a shot of a lake from a friend of mine who owns a home on Lake Tahoma outside of Marion. So our objectives tonight, we already talked about our Enneagram type. We're going to talk about business cards and golden eggs of wisdom. And we're going to talk about the objective is that you'll be able to identify one reason why it's helpful to combine an RN patient advocacy skill with nurse coaching skills. Then we're going to talk about list 3 coping or relaxation skills to help you manage your stress. So I'm going to, I don't know where my cursor here is. Here we are. And so this is our little step-by-step menu of things that we're all going through. So we know you all probably have a notebook or someplace where you're putting all of your ideas, thoughts, pictures, poems, whatever inspires you about starting your own business, and that you will have hopefully identified a business name or two. And hopefully we haven't gotten to our business structure, but we are going to have a person named Michelle Trox come and talk about that. And then we said, once you have your business name, you're going to go find an internet domain that you create with your business name. And we said you all would find a SCORE chapter or maybe a community college chapter with a business entrepreneurship coursework there. And then we've talked about establishing your WOW criteria, where you worked with Jan Nickerson to identify how you would magnetize your famous customers to you. Michelle Trox is going to talk to you about buying an EIN number. That's your federal tax ID number. And when we have her come and speak, I'm thinking she may speak on November 16th, roughly. But the point I want to say about this, it's free, and it's more free. And when I did it, this pop-up screen popped up that simulated exactly what the government website looked like. And it said I had to pay $75. And I said, I thought it was free. And I paid the $75, and then I found out I was scammed. So the scammers can emulate any kind of screen anywhere. So you just have to be helpful. We said that it's helpful to, Sarah Benoit said, it's helpful if you have a person help build and design your website, but some of you are trying that experience on your own. And it's good to know what your favorite colors are, what kind of pictures really resonate with you to include those, what pictures really speak to you. And now it's a time to start working on a few of those landing pages. A landing page is a page that the customer can click on to find out about you and your work. So there would be about me pages, or there's your work, and there might be a contact page, or there might be a blog page. But a good place to start working now is to write your about me page. So that means you want to write a story, the story of Anne Maria, or the story of Chelsea, the story of Kelly, the story of Mary. And it's really important that you write the story about your life and what on earth compelled you to go into nursing and what on earth compelled you to go into private practice. So my About Me page starts out with my story. When I was 13, my mother became profoundly ill and was diagnosed with paranoid schizophrenia, and my father left her. She had 5 children. I was the oldest of 5 children. She progressively got worse. She couldn't take care of us. She couldn't take of the home. We had to have houses foreclosed upon and evictions, no lights, no water. And it was really embarrassing for me as a teenager to have to go to school and say I couldn't do my homework because it was dark. And all of that living in poverty had a big, big influence on me, because when you come from a poverty environment, a lot of you know this, that there's a lot of diminishment. It's diminishment of you as a person. And so that really impacted me. And then through a set of miracles, I was able to go to college on scholarships, and I was able to graduate from high school somehow. And I had a fleet of angels and persons on whose shoulders I could stand during all that time. And that's what guided me to nursing. And then after that, along the way, I learned about holistic criteria and ways for me to manage my stress. And then I learned about becoming a holistic nurse and becoming a nurse coach. And that all informed me to start my own business. So, what is your story, and why did you become a nurse? What went on with you as a child, or as an adolescent, or as a adult? And what choices did you make, and what brought you to this place? So people don't really want to hear that, well, yes, my name's Karen Sanders, and I went to graduate school, and I went to baccalaureate school, and I became a nurse. No, they don't want to hear that. They want to know what kind of person you are, and what kind of person are you that's going to help me do my working through this crazy healthcare system. So FYI, we'll probably have a class on the building of my page, your About Your page. And if some of you feel compelled to share your stories, that would be great. So now, we've had Gary Heisey come and talk about your business plan. Who are your customers? Tonight we're going to talk about coping and relaxation skills. And then we're going to briefly mention about working on creating your business cards, including your picture, credentials, name of your business, your cell number, your email address, website, logo, and a brief description of what you do. And we want to make sure that your card is readable so elders can see it, because your customers, your clients are going to be mostly older adults. And the reason they're going to want you is because the metric that the National Institutes of Health have, as well as AARP, as well as many other sites, say that a huge number of people who are over the age of 65 years have 2 or more comorbidities. And as we gently age, there are more comorbidities. So people are dealing with diabetes, or they're dealing with hypertension, or they're dealing with osteoarthritis. So they're going to want to find you to say, help me, go see a doctor, help me, I'm in the hospital, I've fallen and broken my hip, etc. So the people that are going to look at your business cards the most are elders. So I just want to show you, this is my first card. And this is called Golden Eggs of Wisdom, Help You Start Your Own Private Practice as a Holistic RN, Business Cards, Do's and Don'ts. So I had a friend who was an artist, and he loved computer images. So I sat down one day with him in 2015 and said, will you help me make a business card? So he found this beautiful abstract painting from France somewhere, and we bought the image and he put it on my business card. So really up front and really close, it looks pretty fabulous. But when you step away from it, it's impossible to read. And furthermore, when I was buying my business cards, I said, oh, I want that glossy look. So I want glossy front and back. Have you all ever tried to write on a glossy business card? It does not work, especially if you have a ballpoint pen. You actually need a Sharpie, and who carries those around? So, so the background of this card is too busy and it's too slick and people can't read it. By the way, this was mine. And then on the back, I put my two things that I do. I help patients, families negotiate complex healthcare settings, and I assist, teach, and coach people in the nursing and healthcare professions. So I'm going to stop sharing for just a minute. I'm going to show you this. So this is what my card looks like, okay? And I'm showing this to you where you're up front and close. But if I'm standing back here and I'm giving you my card, and let's say you don't have very good glasses, can you read that? The answer is no. It's even better on the back of the card. How about that? Okay. So just saying, I'm just sharing. There's lots of mistakes I can share with you about everything. But anyway, so now we are going to go to the next slide, which is down here. Okay, so now this is the card that I had redone totally. So it's a fairly attractive picture on the card. I heard from many people, I want your picture on your card because people who know you give me your card, but I don't know what you look like and I want to know. I can tell a lot by what a person looks like. So a friend of mine, I think, Mark, did you take this picture? I think you did. Did you take this picture? Yeah, Mark
Yes.
and I were out doing something and a cherry tree was in bloom. So I hauled off and stood in front of it and he took it. That became my picture. And then the printer put it in this cute little circle bubble, which I thought was pretty nice. So you can see, I also have my logo. My name is big, got my credentials, what I am, what my website is, what the training institute, my phone number, my email, and my email again. So, and it's just a card. So you can write on it, you can write ballpoint pen, and it stays. And then on the back, it's in a bigger font and it's black and you can see it. So those are the lessons learned for creating a business card. Okay. I'm going to stop sharing because now we're going to go into the next our little PowerPoint. But before we move along, do you guys have any questions about business cards while we're on it? And one of your class colleagues called today about this very thing, and it sparked me to say, I think we better talk about this in class. Any questions? Okay. Stella, do I have any questions? Melody?
No, Karen, you answered them all.
All righty. All right. So let's move right along. Now we're going to go into, we are going to, I don't want that up there, but let's see if I can do another one. Yeah, this is the one. So we're going to start this from first. So Linda Bark, I'm trying to see where this starts over here. Presentation mode, slideshow, current from slide. Okay. Linda Bark and I did a presentation together at the American Holistic Nurse Association meeting in Albuquerque this year. And the title was Combining Holistic RN Patient Advocacy and Nurse Coaching. And so I don't know that I talked about this last week, but Linda has been one of my humongous teachers in my life about teaching me about coaching and working with clients. And I went to one of her all-day classes at American Holistic Nurse Association meeting in Lake Tahoe in 2007. So She's been my teacher, an incredible teacher for a long time. And so I've learned a lot about her and coaching in the way that's a structure to teach you how to work with patients. So I'm just going to go through these for a minute. And I'm going to start here by, we're going to talk about two key aspects of the US healthcare system. You all have heard that, 3 reasons why patients and families seek a holistic RN patient advocate. 2 standards from the State Nurse Practice Act list 3 benefits to being a nurse coach and describe 1 way in which the role of the holistic patient advocate and the nurse coach complement each other. So we're going to talk about the landscape of the US healthcare system. And you all have already heard a lot about this, so I'm not going to spend too much time. I could have about 100 slides on this thing, but you know, the physicians are viewed as our gatekeepers, and there seems to be a lot of disregard for customer service. And no living human being can keep up with all the data that comes out. And we have about 30 minutes a year to compress all our healthcare counseling into just 30 tiny minutes. And we know that medical errors are one of the leading causes of death in the US. And the big biggie, and this one I run up against every day, that 80% of medical errors occur during handoffs, especially when going from one facility to another, like going from a hospital to a skilled facility or others. And we know that we have a horrific nursing shortage, exacerbated now by the pandemic and burnout, and it's the worst shortage we've ever seen in our lives. And patients are having difficulty accessing high quality, affordable health care. We know that nurses and CNAs aren't being paid enough, and if there are environments that are fraught with physical, mental, and emotional exhaustion. We also know that nurses are overworked and underpaid, and we know that travel nurses are paid as much as 5 to 15 times the average pay of bedside nurses, and the average number of years of experience of a travel nurse is 3 years. For CNAs, we know their average hourly rate at a hospital is $10 to $15 an hour, and we now know there's a huge turnover in nursing assistants, and there's high demand for CNAs in all healthcare facilities. We talked about moral injury and moral distress, and these 2 statements in yellow really resonate with me. It's a deep soul wound that pierces our identity and our sense of morality and our relationship to society. And the bottom one is the one: routine, incessant betrayals of patient care and trust are examples of death by 1,000 cuts. And after you've gotten hundreds of those death by 1,000 cuts, then you say, I can't take it anymore. We've talked about serious mistakes that nurses make, the biggest one being not asking for help, and that they violate their Nurse Practice Act and their ANA Code of Ethics and the Patient Bill of Rights and Standards of Care because they just don't know those contents. And we also know that there are many patient advocates that don't have any healthcare experience at all. So what is the role of the holistic RN patient advocate? We've talked about this. There are many, actually lots of organizations to which you can belong to get your not necessarily a certification, but have a professional affiliation. And we've talked about you can be a BCPA, board certified patient advocate, and the annual amount, not the annual amount, but the amount to take that exam is $395. Don't necessarily have to have healthcare experience to take this exam. And so I always tell people to whom I'm lecturing that I always say, whomever you choose as your healthcare advocate, you should ask him how many years experience in healthcare have they had, preferably 10 years or more, and what is their educational degree as a professional. Is it a registered nurse? Is it an LPN? CNA, is it a PT, is it OT? But it's very important to know that. Then Winston Churchill's quote of never, never giving in. And we know that an advocate is a person who stands out, speaks up, or calls out on behalf of someone else. And we know if you don't speak up, someone else is going to speak up for you. And we know that the tools of the advocate are always words. And the public face wants an advocate to be not afraid to ask questions, to be cool under pressure, be a good communicator, and know the patient well. And a holistic RN patient advocate is someone who focuses on the physical, mental, emotional, spiritual, environmental, and financial aspects of the whole person so that we can support and intercede on behalf of the person anywhere along the healthcare continuum. And we all talked about finding our Nurse Practice Act. And in North Carolina, not only are you held accountable to that, you're held accountable to the American Nurses Association, Nursing Code of Ethics, whichever agency's patient bill of rights and the standards of care against which you're being compared. And I just want to show you, I don't remember if I showed you the North Carolina Nurse Practice Act. There are 10 provisions, and they're all starting with a gerund. And we know a gerund in grammar is a verb with an ing on the end. So the first three are assessing, recording, reporting, planning, and initiating. So just to know that. And sometimes it feels like our State Nurse Practice Act is too big and too much to remember. This thing I'm showing you is called the Pisgah Astronomical Research Institute, which is deep in one of our Pisgah forests. Used to be a NASA site and the CIA, and it's one of only a very few dark spaces on the East Coast. That means there are no lights anywhere. It's deep in the forest. And then the ANA Code of Ethics, I'm not going to read you these 9 provisions, but nurses don't know in our state you're responsible for this. But provision number 3 says we promote and advocate to protect the health and safety and rights of patients. And then I've reviewed this last week, but the top 3 reasons why patients and families seek a holistic RN patient advocate to me, please help me, I'm in the hospital, no one's responding to me and my calls for help, is staying at home as I age less expensive than going to a facility. Not necessarily, oftentimes it's a lot more, especially if you have 24-hour care. And I'm in the hospital and they are sending me to a very short staff skill facility. What do I do? So that's a little bit about the holistic nurse role. And then we have the role of the nurse coach, which Linda actually had you all coach her last week. So I thought it would be good just to review what a nurse coach does. So it is a skilled, personal, purposeful, results-oriented process. It's a structured relationship. She talked about the 7 magic questions that are very structured. To get your certification nationally, you have to have a BSN or advanced practice nursing degree, and the purpose of promoting the person's goals.
Karen, can I?
Yes.
Forgive me
Yes.
for
Yes.
interrupting. Dave, the AHNCC has actually changed that starting last December. You can now take the board certification exam with an ASN as long as you have at least 5 years nursing experience in the hospital.
That's really good to know. Thank you, Mary. That's very good to know. Thank you. And by the way, for this course, I never ever require anyone to have advanced degrees. I think associate degree nurses with tons of experience are certainly going to enable you to be able to practice as a skilled holistic RN patient advocate. So other things about defining the role of a nurse coach, and Linda talked about this, you're co-creating a partnership with the patient or the client. And one of the very skillful things you can do as a nurse coach is you can group coach, which is pretty cool. And we always need to remember that The client is the expert on their own selves and in their own care. And it's really hard for us as nurses to set aside our expert role and let the patient be the expert. And, you know, we are all used to saying, Miss Jones, your A1C is 15, and I see that your family is bringing in Cokes and Oreo crackers and bags of chips on the night shift, and that is just not helping you. You need to stop eating that. And of course, we know that approach doesn't work very well. And the goals of a coaching relationship occur with the client. And so part of nurse coaching is education, consulting, ask the client what they really think they need and paying attention to red flags and asking permission. And this is the book that Linda was talking about that she's a co-author of. This is The Art and Science of Nurse Coaching. I can't wait to get my hands on it. And you all can't see this, but it is Mary Elaine Southard, Barbara Dossi, Linda Bark, and Bonnie Schwab. So those are the authors. So I'm really looking forward to getting this book. And then she alluded to about 3 different articles, but one of her big ones that she spoke about last week was a metaphor analysis of patients with chronic conditions and experiences with holistic nurse coaching. And that article is really amazing because the authors went through and looked at the patient responses to being coached and their metaphors to explain how nurse coaching was a beautiful thing. And when they looked at these cohorts, there were 8 theme clusters that emerged about why people want to be coached, and that's seeking guidance to navigate your life. It's a safe and sacred place. The patient nor the client always feels empowered and accountable. And when you allow the patient to come up with strategies, they always do, to access them in different ways. And they can find the answers within, and they can make healthy behavioral changes. And the nurse coach and the client develop a great relationship. And it's a very transformative process. And other benefits, it's very meaningful. It's less work for the coach than more work. It's less stressful. And in private practice, you can have your own schedule, select your clients, have more work balance, and can work at your whole potential. And I don't think Linda talked about this, but there's a big cohort of coaches in the US that have been working on getting CPT codes for coaching to get it reimbursed by Medicare and Medicaid. So they've developed some category 3 CPT codes, which are not reimbursable, but they've developed these codes, like this one is 0591T, health and well-being coaching, face-to-face individual assessment. And so I think we're getting there with time to have nurse coaches reimbursed. And then that's one of my things I'm starting to work on, is to create a work group to create a national holistic RN patient advocacy certification exam, which will enable us to be reimbursing for our work too. So how do these roles integrate? So the holistic patient advocate tells you what and to do, and the nurse coach tells you how to do it. And the other way I like to think about nurse coaching is it really teaches you how to talk and speak to your patients, which is with those 7 magic questions. So one of the last things to talk about, which you all are going to be learning about in a few weeks, are the intake forms that I use, that I've developed, and which I will be giving you all. And these are called SOAP and FANCAPES forms. A lot of you know what the SOAP acronym, how old is that? Pretty old, but it's so old, it works so great. And that's subjective, objective assessment plan. And inside that acronym, the subjective is how can I help you? And what would you like to focus on? And under that is the objective. And so the FANCAPES is a very long-standing geriatric acronym called FANCAPES, which stands for fluids, A for aeration, N for nutrition, C for communication cognition, A is for activity, P is for pain or polypharmacy, E is for elimination, and S could be social support, spirituality, skin, or sexuality. And then after you hear all that from the patient, then you make your assessment and then you make your plan. That's how I document. So going back to Linda's 7 magic questions, she asked what she did is when she went around to each of you, she was having you do the 7 magic questions, which started out with, we have 20 minutes to spend together. What would you like to listen? I mean, what would you like to focus on? And then you would have a response, and then she would always paraphrase it. Number 2, how will it look and feel when you reach your goal? She's going to listen, and then the coach is going to paraphrase that. How is the goal aligned with your sense of purpose? Where do you want to be by the end of the session? What process do you want to use to reach your goal? What's fun and easy homework? And what is your takeaway? So that is the structure, the famous 7 magic questions that we all use as coaches, and they're fabulous questions. So then Linda and I told stories about clients that we had come through, and I'm going to share that story with you. And then I'm going to stop sharing here. And so I'm going to let you all listen to this story. And then I'm going to ask you, what do you think? Okay. So this is a true story. So and this story was happening. She was hospitalized while I was in Albuquerque, Mary, giving this talk. And this is a 74-year-old white female who was a Cherokee. She's a practicing Cherokee, and she followed Cherokee traditions. And she had a big event. She got admitted to a step-down unit at our medical center, which was bought by the giant for-profit healthcare system, HCA. So what happened, unbeknownst to me, is she fell in the kitchen and was down for 24 hours and nobody knew anything about it. And it was fortunate that one of her friends called her and woke her up, and she couldn't get off the floor, but they called 911. And when she got to the hospital, she had AFib, right upper quadrant pneumonia, septic shock, and fluid resuscitated in the ED. So she was really sick. And she was treated with diltiazem and metoprolol and Rocephin, and she was there for about a week. And then they decided she was too weak to go home. So she needed to go to a rehab facility. Okay. This is where it gets interesting, which is what I'm going to ask you in a minute. So, as an aside, this hospital has 1,800 nursing positions. And during the week she was there were employed 1,295 travelers. That's right, 1,295 travelers, which means 67% of all the nursing staff were travelers. And all of the nurses that took care of her in a week were travelers except for one. So, and by the way, the hospital was unionized in October 2021, so about a year ago. And so she still was cognitively impaired, a little confused. And so they wanted to send her to a skilled facility. They wanted to send her to a rehab. So the problem was that she had, Sandy Dingler's going to like this question, she was on a Medicare Advantage plan. And when I went to look up all the skilled facilities in our region, the 5,
they won't take them.
That's exactly right. They wouldn't take them. And so what happens, and Sandy, you might be able to speak to this. I think she had, I might have been Blue Cross Blue Shield, and they wouldn't take it. And so in our state, in our region, and Chelsea, this will be important for you to know, there are 31 skill facilities in and around Asheville. And most all of them, not all of them, have designated rehabilitation beds. And so if you'll know that Medicare pays more for a rehab bed than it does a skill facility bed. So what do skill facilities do? They convert a lot of their beds to rehab. So because I'm in the Medicare.gov nursing home compare scores every day, I knew the top 5 skill facilities with 4-star staffing or 5-star overall. And I called them all and they would not accept her insurance, not one of them. And this took a week. It took a week. And you have to, get the FL2 to be completed by the case manager. And then they look at their insurance and then they call up and they say, I'm sorry, we can't take her. So then you look at the other 26 facilities, all of which had 1 or 2-star staffing or 3-star staffing if you're lucky. And it took a week. And by the time they were finished trying to find somewhere, it was a week later. And she just said, what do you think? So I'm going to stop there and say, what would you do with this patient?
Stay home.
Who said stay home? Yep. And Maria, anybody else? Anybody else have a thought?
I would say stay at home with home health.
Okay.
PTOT.
That's
Okay.
very limited as well.
Say that again, Sandy.
Oh, I didn't mean to interrupt.
That's okay. What did you say?
I said with the I call them HMOs, they limit the visits. Sometimes for somebody that's had a stroke, they will only approve 1 speech therapy visit at a time. 1 visit. Oh yeah. It's a big topic.
1 visit post-discharge?
Yeah, post-discharge from a skilled facility or a hospital. They'll do 1, they'll wait until they get some documentation in, and then they may give another one. But meanwhile, the patient is not benefiting from that. This is extremely common. Extremely.
I have a man post-cabbage right now, been sitting in the hospital for 2 weeks, waiting to go to a rehab facility. First, he walked 150 feet, which was too far. So then they were going to get him in the other facility, but they're re-looking at his insurance, but he has so many comorbidities. He aspirated, so he's got a feeding tube and he can't really swallow. He's doing better with his swallowing. He was totally independent prior. And it's crazy.
It's crazy.
Yeah, if you allow me to have 1 minute, I would like to help our patients, or just for general info. These patients or anybody in the public, they get bombarded with all these ads. They make them look like they're really from Medicare or Social Security, and they're not. And people get very confused. And I have helped patients, or I call them patients, do this. Okay, let's call each one and tell them you don't want these mailers anymore. And then let's just write a note and send that off. When my husband became eligible, we were getting a big grocery bag and a half of mailings every week. I just had to say that. I didn't mean to.
That's okay,
interrupt
Sandy.
you.
That's all right. So now let me just ask you one question before we go to break. So then she went home, and she went home with home health, and she went home. Nothing was wrong with her speech, but she had terrible, she was very unstable and she had been very dehydrated. So she needed to have PT and OT. So she got those services for about a month. Okay, so now we're finished with all that. And then she had a nephew come and stay with her for a month. So she had the benefit of a family member. So now all that's happened and she's trying to afford her medications. And she's on, remember, she's on a Medicare Advantage plan. So now you as the holistic RN patient advocate, what would you recommend to her now? This is kind of a trick question.
One thing I would do is contact the pharmacy, because pharmacies, I know in my dealings with case management, pharmacies have odd ways of covering medications, not covering medications, only covering generic and not covering brand names. So I would see if the medication was covered, and if some of them weren't, contact the provider to maybe get a generic as a substitute.
Excellent. You get a $5 candy bar.
So
that's one thing that happened. So we did that. Okay, one more. What one more thing could you do? She's on a, I'll give you a hint. She's on
Contact drug companies.
Yes.
Okay, that's true too. And I'm going to give you a hint. She's currently on a Medicare Advantage plan. What's happening all across the country right now in October through December?
Get a different plan.
Oh, vote for somebody different. Enrollment.
That's true, but she can enroll in a traditional Medicare plan. Okay.
yes.
So what she's doing now is we in Asheville, in our region, we have something called the Council on Aging. They do a lot of free Medicare classes. So they teach all about the differences between Medicare Advantage and traditional Medicare. So she's going to a class, and then we're going to sit down and look at all of her options to see how much her deductible would be, how much she would have to pay for a drug plan. And she needs to get off that stinking Medicare Advantage plan. Just saying.
And Karen, I found out the population that I was dealing with in West Baltimore, they sent mailings to the elderly and automatically converted them to HMOs. And the patients didn't even know it until they came in to see their provider, and the provider says, we don't accept your insurance anymore. So they had to contact Medicare and tell them they wanted to be switched back to their original.
They don't understand. They held up their Medicare card. They said, I have this and I have this. And we're like, no, you don't.
That's terrible.
It's unfortunate.
Because that's why I was talking about the mailings.
That's terrible. Why. It's terrible.
It is.
So
it's a scam.
It's terrible. So one of the takeaways for all of you is, if you feel like you don't know much about Medicare, there are all kinds of classes maybe in your community for you to go to and learn about all the differences between traditional Medicare, your supplements, Medicare Advantage plans, et cetera, et cetera. So that's just another takeaway. Okay, y'all did great. Any other questions?
That SHIP program that you told us about, does that help too?
Yes, that's it. Every state has a senior health instruction, forgot the second I program. And that'll be your homework for next week, is to find a SHIP program. All righty. Okay.
And not a scam one.
And not a scam one. So yeah. And your Department of Insurance, on your way, every state has a Department of Insurance. You can get in touch with them about the local SHIP program in your state. Okay. That's your homework. Thank you, Mary. All right. So it is, let's see, it's 8:01. So let's take a whole 6-minute break and come back at 8:07. Okay. righty. We're back. All right. Everybody have a nice little break. So refreshing. Okay, so now we're going to go into coping and relaxation skills for stress management. So you're probably going to get 2 homework assignments. You're going to find a ship place in your state, and you're going to come back next week with 1 additional coping and or relaxation strategy you've never tried, and you're going to try one of these. But there's a lot, so you'll have a lot to choose from. So I'm going to share my screen, and I'm going to stop this one. Well, wait a minute, I might have to stop and try again. I think I know what I did. Oh, goody. Okay. Okay, now we're going to come back here. Okay, here we come. Sharing the screen. Okay. All right. So what coping and relaxation skills do you use at home at work? So we're going to talk about managing stress. Have any of you ever heard of Brian Luke Seward, who is a very famous, okay, Mary, some of you might have taken a course from him. He lives in Boulder, Colorado. He is like the expert on stress management, has taught this content in graduate school for years, and then he's on his 10th edition of this amazing book called Managing Stress. And so I took his course and became a stress management instructor trainer. It's a great, great, great course, and it's just fabulous. So just a quick review, we know that the sympathetic nervous system is like stepping on the gas pedal, and things like stress and being frightened or scared or having a lot of anxiety can start our sympathetic nervous system in its cascade. And the parasympathetic nervous system is like stepping on the brake for the body. And so what we really want to do as nurses and as holistic RNs in private practice, as patient advocates, we want to activate our parasympathetic nervous system to combat stress. And we want to use different coping and relaxation skills to help us manage that. So some of the literature talks about breath awareness, some of it talks about eating, some of it talks about sleeping, and some of it talks about mindfulness. So I'm just going to go through a short list with you of some of the things as a coping strategy. So a coping strategy to reduce stress is one that increases the awareness of the issue and work toward a peaceful resolution. So let's take a look at these. So the purpose of effective coping skills is to bring awareness to us. And so the first one is time management. And that's the way we prioritize, schedule, and execute our daily responsibilities. And the thing that's different for all of us when we go into private practice for ourselves, we are used to having our work lives run by the hospital schedule or the home health agency schedule or a skill facility schedule. But when you move into your dining room or your home office, your time management is going to be completely up to you, including all the potential distractions you can have, such as people knocking on your door saying, you know, you have a tree that's fallen down in our driveway. So it's a whole nother way to think about time management. And so just some of the strategies, and we all know this about just taking a look at how we spend our time and setting priorities. Some people use a planning tool, blocking out time, delegating, procrastinating, evaluating, and self-care. So for me, for my time management, I meditate every morning, and I have 2 books that I'm reading, The Course in Miracles, and then there's this wonderful book by Eileen Caddy for daily meditation. So I build that into my schedule, because if I wait to do it at lunchtime or dinner, it's like my hormones and my catecholamines have kicked in and I can't be present. Other types of strategies for coping are prioritization and scheduling and execution. And then to work on our communication skills that are hurtful and damaging. So this picture cracks me up because this is an example of schismogenesis, and it's a term coined by Deborah Tannen, who's a famous communication lecturer and author, and that is that you have exaggerated conversation styles when you're under a lot of stress. We tend to be judgmental, we tend to be triangulating, and we tend to punish in public. So, of course, according to what Linda said, one of the hallmarks of excellent coaching is you become a fabulous listener in focusing your attention on your client and paraphrasing, summarizing, and writing everything your client says when you speak with them. And then there's conflict management. We've all learned in nursing school about using I messages and never using you messages. And then there's the whole issue of incivility that is so much more prevalent in our society, in hospitals. I had to go, let's see, I had to go to Duke University Hospital with a client 3 weeks ago. So we live in Asheville, and Duke University is in Durham, and that's about 4.5 hours from here. So it's a ginormous campus, and he was going to have an ablation of a liver tumor. So we went into the clinic, and he was having his pre-op with anesthesia. We had lunch down in the basement of the cafeteria. That was a whole nother experience. I won't go into that now, but then we walked out, and in the lobby of the hospital, it had a big floor-to-ceiling banner that said, "We will not tolerate civil disobedience, rude behavior, yelling, or screaming at our healthcare staff, and we will ask you to leave." So I thought that was very wonderful that they published that there. So communication skills, one of the things that I've learned for myself is I never go to a conflicted conversation with an emotional charge. So if I hear that a colleague of mine says, that, or a sibling, that generates instant conflict. If a sibling says, "Well, Karen, we don't really care what you say. We're not going to go take our niece to have her vaccinations and she's only 2 months old." Okay. So I could feel my blood pressure rising, and I wanted to say, that's the stupidest thing I've ever heard in my entire life, but I didn't. And so if I had said that's the stupidest thing I'd ever heard in my entire life, I would have, I have an emotional charge, and it's not a very good idea for me to go to any subsequent phone calls with that. So I'm going to that happened just yet 2 days ago. So I'm still mad. So I'm going to probably have to wait about 2 or 3. I might have to wait 2 weeks before I talk to my sister-in-law and say, let's talk about that again. So, because your people who know you can tell when you're upset, and it's going to set the stage for another conflicted conversation. And a psychic told me one time that we all need to go to the fire with integrity, and the fire would be a conflicted communication. And when we go to a conflicted situation or a fire, it's very good for us to use I messages and go with honesty and with no emotional charge. So that's an interesting thing. And there's so much data in Luke's book about precision and the way we talk and being aware of our nonverbal behavior. One of the things I use is journaling. I've always been a journaler. I don't know why. It just feels like when I journal that all of that toxic stress comes right out of the end of the pen. Has to be a pen. I don't like pencils, but it comes right out on the page, and it's a really valuable resource for me. And I'm lucky because I can have big journals here at home. I used to carry little journals with me at work, and I used to journal in the bathroom. And there's all kinds of studies about journaling and what they bring and include in decreasing your blood pressure and helping you grieve and helping you with catharsis of really stressful situations. This was the this was the journal I kept in my pocketbook that is about as big as a salt shaker a little bit, but I could write a lot of stuff in there. And my policy at work was always to write affirmative things, stories, or inspirations. There was no negative things allowed in that journal. I did have another journal that was the negative journal. So, but this was the one I could open up to get some positive support for me. We all know that support groups are very wonderful stress management mechanism, and Alcoholics Anonymous is one of the ones that's been around for many years. And you know, some of us have good friends with whom we've been friends for years, or maybe you're in a cancer support group, so they offer a lot of support. And then there is the whole topic of reframing, which I love this too. And that is when you have a thought process that's negative and you substitute with a positive one and you say the opposite. So you look at something from a new vantage point. So one of the things I used to hear from the nursing staff was, you all are not paying us enough. And our shift differential is not enough. And our weekend differential is not enough. And our call pay is not enough. And I'm sick and tired of not being paid enough. So one of the things that I say to myself when not necessarily back to the person, but if I'm feeling financially strapped about something, then I turn it around and say, but I'm so happy that I have a house. I'm happy that I have furniture, sheets, pillowcases, food in the refrigerator, and I can pay to have gas in my car. So that kind of aborts that negative energy. So those kinds of positive of statements. And then there's some literature about a new thing that's come out in the literature called 3 Good Things. And it's a study that has been implemented and looked at the intervention of saying 3 good things every day. And they studied the positive outcomes of healthcare workers who were experiencing exhaustion, depression, and work-life balance. And it was in the British Medical Journal. And so you say to yourself, what are 3 good things that happened to me today? You can write it at night before you go to bed or the next morning. It's very low cost, easy intervention, and it helps you recover from emotional upheaval. So sometimes I do those 3 good things when I'm really stressed. So I'm going to give you all a minute, and you can just write one good thing in the chat box, and then we'll read those at the end. So what's one good thing that's happened to you today? I always look forward to this class, so you all are my one good thing today. So we talked about reframing, and information seeking is another thing. So one of the things that's very stressful to me is to watch television at this really stressful time where we're being bombarded with every kind of thing going on about Ukraine, everything going on about what's going on in our government, and horrific things that are going on. Today's headline was the huge financial award to the families of Sandy Hook, where the children and the faculty were murdered, and so they won their award. But leading up to that trial and before the award was made were horrific stories being told. So how do we deal with those kinds of stresses? And the way it helps me is if I go Google something that might offset about something that doesn't sound right to me that the press might be presenting, for example. So tools used by Phoenix nurses, and again, those are nurses who made big mistakes. A lot of them have used reframing and dream therapy and art therapy and forgiveness and creative problem solving. So it's really good to have stress management strategies to address the causes. And so the next topic is relaxation skills. So this was a very interesting article about micro practices for burnout prevention and emotional wellness in the Journal of the American College of Radiology, for heaven's sakes. And in this, the radiologist talked about hand hygiene was a quick and dirty way to do it, where you're washing your hands and bringing to your soul about self-awareness and self-management, and you might be washing your stress away. Another thing he talked about is just focusing on one's breath, which helps you center and visualize your presence. And maybe even when you're sitting at a red light, just sitting there and being grateful. And any of these things kind of help you shift your energy. They're called micro strategies. So this is a list of some of the relaxation skills we'll review. And we all know that the purpose of relaxation is to return our body back to a sense of physiological balance. I love this picture of breathing exercises. When I saw it, I had to go get it. So I got Mark to help me buy this picture of a breathing exercise. I think that is so beautiful. And Greg has already done his talk on heart math, so I'm going to skip all that in terms of the resilience and the heart focused breathing that brings about. Let's see, I lost the page. Here we go. And emotions. And so taking a pause is another strategy. So when I was working as a director of acute care in a small hospital, when I was really upset, and I felt like sometimes I would get so upset, I felt like I had a C-clamp on my aorta. So I'd go into the bathroom and I'd take 10 to 20 breaths so I could get my heart rate down and my blood pressure down. And then every once in a while, the staff would find me and they'd knock on the door and I'd say, "I'm not through yet." But anyway, being in a quiet place, even in the midst of extreme stress, is very helpful. And this was my favorite place of all for great deep breathing. They're all over. You never can say there's no place to breathe. Isn't this the prettiest picture of a toilet? And oh, what about this one? And look at this one. Oh, yes. And so at one of the places I worked, I just got a bunch of stones and candles and put it on the floor. Housekeeping didn't like them. So I had to put all the stones, have the stones on the floor. Housekeeping said, "Karen, you have to get those stones off the floor." So I put them in a bottle. And then I had to put the candles in the bottle, but they still work. And then another picture with the candles in the bottle with the stones. And so another key thing about stress management is to think about what is mattering. And this is some new literature that just came out by these authors about how organizations, patients, and peers can affect nurse burnout and engagement. So what is mattering? It describes a feeling that one makes a difference in the lives of others and has significance in one's community. So the point is we all want to feel like we matter to someone, or if we work, to some people at work. And we know that affirming interactions with other healthcare team members, like, "Mary, you did such a great job. Thank you so much for your help today, Stella." And we know that emotional exhaustion and cynicism predict a nurse's desire to leave his or her job because there's no positive, feedback. So there's 4 parts to mattering: awareness, That means would anyone notice if you left? Reliance, others depend on you. Importance and ego extensions, others feel a sense of pride in your accomplishments. So that's a little bit about mattering. Here in these mountains, we have the beauty of doing forest bathing, walking in nature. And this is my biggie. This is my favorite one. This came from the Japanese practice of Shinrin Yoku, taking in the forest atmosphere for forest bathing. And they did all these field experiments in Japan and saw that it decreases your heart rate, your blood pressure, your blood sugar, and decreases salivary cortisol. And now, for heaven's sakes, there's the Association of Nature and Forest Therapy Guides and Programs. And I have a couple of nurse programs who've taken this training, and now they're doing forest training groups in our forest. This talks about the science behind forest bathing, resetting our stress button, and all kinds of literature is being pushed. And it's just great. We know that physical exercise is a huge strategy in terms of reducing our catecholamines. And the effects of physical exercise are too numerous to go through, but we know there's gazillions of subsequent wonderful benefits of physical exercise and psychological exercise. And then meditation is one of my favorites. And I love this quote. It's like an eraser that cleans the mind's blackboard. And there's so many literature studies showing the benefits of meditation, the physiologic decrease of oxygen consumption and lactic acid and heart rate, blood pressure and muscle tension. And then there's different types of mental repetition, visual concentration, repeated sounds, physical repetition, and tactile repetition. And I wanted to tell you there are a couple of apps. I think some of you might know about Headspace. And then there's one called, there's a bowl, and I'm going to tell you what it's called, Insight Timer. So for me, listening to ocean waves takes me to a place far, far away. And I turn on this ocean wave music for 30 minutes, and it's great. And then John Kabat-Zinn developed about mindfulness-based stress reduction in terms of focusing on your awareness and your breath and doing a body scan. And there's many, many benefits to doing that. And then there's guided imagery. So in Luke's class, he actually has you write a script for someone else about helping them. You would play music of whatever kind the person wanted, then you would write a script. So I want you to close your eyes. I want you to focus on your breathing. I want you to breathe 10 times in and out. I want you to focus on your feet. Now you're on your toes, and now relax your knees. So it's pretty fascinating. And guided imagery, they're also on Insight Timer, all kinds of guided imagery exercises you can do. And then, of course, a lot of us, music takes us to places that are totally enchanting, and it's a wonderful thing. One of the other things I do are essential oils, and Helen Keller, I love this. This quote is, smell is a potent wizard that takes us across thousands of miles in all the years we have lived in a second. And there's all kinds of essential oils, and probably a lot of us have our own favorites. And we know that different oils stimulate different parts of the brain, and they do all kinds of things to our body. This is an actual medication card that we had at Transylvania Regional Hospital, where we kept oils in the bottom of the med cart, and we bought our oils from a distillery in France. And we had this little recipe where we put 2 drops of lavender or 2 drops of ginger on a cotton ball and tape them to the edge of their neck. And then we would put them on about every 2 to 4 hours. And they got so popular with the patients and the families and the doctors that we started selling these oils in the hospital gift shop. It was pretty funny. Another one that's really important for me is art therapy. It's a method of self-expression that takes us to a place very far, far away. This was a beautiful piece of art that said, How do people make it through life without a sister? And then on Nurses Day at Transylvania, we had the nurses come in and paint. Their instructions were, we want you to paint, what does healing look like to you? So this is a flag that says the wound is the place where the light enters you. This was my flag. And then we had a whole big display, and Florence Nightingale's quote, nursing is an art. If it is to be made an art, it requires as exclusive a devotion, as hard a preparation as any painter's or sculptor's work. So we set up the conference room with all kinds of paints. We set up frames and silk to keep them still. And then they painted these incredible flags. And then we hung them up all over the hospital. They were on all the windows, and it was just a cherished experience to walk down the hall and see these beautiful flags that these nurses had made, and then they gave them to the hospital. Almost lastly is the power massage. I would bet there's not one person in our room that hasn't had a massage. And then for Nurses Day, we did hand massage, and it was just a 5-minute massage, but it sort of also referred to as reflexology in your hands. And it was a specific procedure we taught all the nursing staff. Yoga, we know, is a big one also for stress management. And this is a woman who lives here in Asheville, and she's like the Yoda of yoga, and she's awesome. And then healing touch. And so these are some more little excerpts from the literature about people using different stress management. And then you might know about something they've been doing at the Cleveland Clinic called Code Lavender. And this was generated there, and it's like an emotional code blue, but they call it Code Lavender. And it's a crisis intervention tool to support any person or patient or family going through a horrific emotional crisis. So they overhead page those. So we implemented that at our hospital. And when we did, everyone would stop what they were doing and send a prayer or a thought to the location. Usually it was in the emergency room. So just to summarize, we've talked about taking pauses. We've talked about conflict management. We've talked about journaling, talked about physical exercise, talked about a lot of different ways to manage our stress. And in summary, we too can have 3 good things, and we can have a bathroom, and we can have a pause, and we can have a lot of relaxation and stress management therapies for ourselves, because we're going to be busy. Questions about all that? That was very fast. And questions about anything? So there's a lot of comments here in the chat. So let's do this. Mary, I'm sorry I didn't hear to mute people. It looks like Mark's muted everyone. Okay. So Mark said his 3 good things are class smiles. Marcia said re-engaging in life. Chelsea said had a breakfast date with her husband. Melody said I was able to sleep in this morning. Good. Stella said positive reinforcement. Kelly said great teamwork. And Marcia said when my kids were at home every family dinner, they had to tell me 5 good things about they do with their day. Now they do it with their children. How lovely. And Sandy said work canceled last couple hours of training day and did not assign anything else. Yay. Hooray. Thank you for all that feedback. So any questions before we do takeaways? All right, are we ready to do takeaways then? We're going to get out early. That's a good thing. Okay. So let's see, takeaways. Okay, Miss Kelly, what's your takeaway for tonight?
I'm going to encourage my patient and family that they need to relook at their insurance enrollment that's
Yeah.
been sitting there for 2 weeks.
Yes. It's really, and I think, we talked about Ollie, being one of our resources that Mark and I have available to us. And I do, I do some other volunteer work, but I also am in a Ollie chat group. And every time I get a chance, I say, please do not choose Medicare Advantage plans. I'm just saying. But anyway, thank you for your comment, Kelly. Okay, Mary, what about you?
Well, now that you just mentioned it, I'm getting ready. You're supposed to enroll or to qualify for Medicare so many months before your 65th. So I'm at that point. And I mean, not that I'm ready to start thinking about Advantage or any other because I'm still working, but I'm happy to be learning this because I know not to enroll for that. So that's my takeaway.
Good. Thank you. Okay. And Chelsea.
My takeaway is they now let the ASNs take the exam for the nurse coaching. That is huge for me. That's why I've not done it in the last couple of years. So I'm really excited.
Oh, good.
Thank you, Mary.
Yay, that's wonderful. Isn't that good? Okay. And Marcia.
Wow, so much. I want to spend some time going over everything that you covered tonight. I would have to say the Medicare thing, because I'm at the point where I haven't signed up for it because I've always had insurance. So I'm at the point now where like Mary, I have to sign up for it. And I'm kind of baffled because I was really under the impression that the Medicare Advantage was the way to go. So
I'm so happy you all are going to look at that. Great. Thank you, Marcia. Okay, Miss Stella.
Well, let me see, am I on mute? No. Again, a lot of information, Karen, thank you. But I guess the thing that I'm really excited about is the CPT codes, because I know eventually you're going to cover billing and reimbursement. And I think that's a plus for us going forward to be reimbursed for the services we're going to provide.
Amen.
If
Amen.
I may add, because whatever, we as patient advocates and nurse coaches, our documentation is so important because some of that is what they can use for research to show how it's working and prove that this can benefit and it's cost effective. So I'm sorry, that's my 2 cents worth.
It's a good 2 cents worth. Stella, did we get everything you needed to say?
Yes.
Awesome.
Yes.
Thank you. Okay, Anne Maria, what about you? Oh, you're muted, Anne Maria.
I've been involved recently with my brother-in-law and some other friends in regard to this Medicare HMO. And believe it or not, if you don't have Medicaid in the United States, which is like the golden card, and you have either HMO or a supplement, it doesn't cover for everything. I mean, like I'll be 72 this October, or rather next week. And I have like part A. I chose to hold on to start taking my checks until age 70 to get the maximum. But I'm covered by, Medicare Part A, and my union covers the rest of it. But I'm on workman's comp right now, and I'm saying to myself, what's going to happen, February when my workman's comp ends, or my what the heck is the other, Cobra ends?
Oh yeah.
And I mean, right now I'm paying $900 per month for $11.99 benefit.
Oh.
So every time I need something and it involves a part of my body that may be covered underneath workman's comp, I get these nice little notes. Oh, this is not covered. You have to go back to this. You have to go, and it's a shame because you get so, I think on a day-to-day basis, I get between 30 and 40 phone calls in regard to this Medicare Advantage. And thank God that, I did case management before, so I'm quite aware of, the ins and outs. Like Stella said, I really would like to see how they're going to do either with the ICD coding so that we can get paid for this. Because even as a practitioner, you're like pulling teeth, trying to get paid for your service.
Mm-hmm.
Oh, well, if you're not followed by a doctor or something like that, we're not really going to cover you, as a practitioner, not realizing that. I mean, like me, I went into medicine and then went into nursing and then went back into nursing and took my Medscape and passed. But I feel that this is an area that we're not recognized for, and we really should be, whether it's advocacy or coaching or whatever, that we should be paid for what we are worth. We have a hell of a lot more education than a lot of people that are making the six figures, where a lot of nurses, depending on the state, I mean, besides California, they have a good pay scale, and also Texas. But I mean, there are states where nurses are not even making $50 to $60 or $70 an hour.
Oh yeah.
And it's so sad because you have to go and get I mean, like I went through the college programs. Thank God I went through what they call Regent Scholarship here in New York. But the person that goes to a nursing school and tries to get ahead, you can't go anywhere, because they're always going to say, you don't have this and you don't have that, and you can't get skilled for this. You have to work for a doctor so that you can get paid for your little, practitioner license that you work so hard for. So that's my takeaway.
Thank you, Melody. Woo. I mean, thank you, Anne Maria. Now, Melody, sorry.
My takeaway is I'm going to sign up with Massage Envy. We'll start there. So I can.
You'll love it. You'll love it.
I have just because I got to tell you that I'm in Florida, and of course I don't know if you guys are aware, but Florida is the worst paying state for nurses, the worst of any state. And I can tell you that because I've been with HCA since 1996. And in 97, I was making $35 an hour as a house supervisor. And even today, that is what they start their nurses at. So they have not changed their pay grade since 96. I mean, I do agency and I travel, and even has doing house supervision right now, it's not paying anything. Like I'm making my bills and that's it. There's no extra money to put back for anything, no extra money. And my poor little CNAs are getting hammered, and they're making $12 an hour.
I know it. Oh.
I mean, it's just, and they bust their butts. The staffing part is the worst of this job, trying to get staff, because nobody wants to work. They're up to 8 patients per nurse.
Oh.
And then they wonder why things go wrong or something happens. And the nurse is at fault. I also do legal nurse consulting. And, before we were allowed to use the doctor ordered it. It was a doctor's order. We're not covered by that anymore.
Nope, we're
and
not.
star RNs that are coming out of school, they had virtual
clinicals.
Yeah.
They don't know.
They know
how
nothing. I mean, like
scary.
I had a star RN ask me if there was a class for I's and O's. Are you
Oh my gosh.
I's and O's? He said, baby, do you have trouble with math? I mean, because that's basically what it is adding and subtracting. She said, well, no.
Think about if they had to calculate a drip when it was actually dripping.
You don't know how to
watch.
Listen, I took over a patient in ICU at another HCA facility about 4 months ago on the heparin drip. And I don't know about the rest of you, but the heparin drip is the easiest thing to do. We've been doing them forever. It is the easiest. And the pumps now educate them out. All you have to do is put in the weight and stuff, and the pump will automatically set it up for you. 2 nurses verified this. Patient was supposed to be on 15 units. they were on 1.5 units and I couldn't understand because that's how they said it. So the patient was only getting 1.5 units an hour and is supposed to be getting 15 units an hour, and 2 nurses verified it. I mean, it is just scary. The whole situation is just scary. And then for patients to go in and not know what they're up against or what to ask for, or, I mean, I had a lady who ended up with 3 CAT scans in 2 days, and she had a ruptured bowel. They did 3 CAT scans before they took her to surgery. There was no reasoning for that. Or my DNR, the lady was a DNR. She was 97 years old. They wanted to send her for an MRI. Why? We're not going to do anything. The family doesn't want anything. I told the doctor the family refused. Lady didn't have no family, but he didn't know that. I mean, it was her spouse, or her husband, but I'm not going to call him at 3 o'clock in the morning and wake him up for something that he was adamant, please don't do anything else. Let her rest. It's just, so yeah, massage envy will work really well for me. Because I can tell you, trying to find 15 minutes, even 5 minutes in the bathroom does not work. My phone rings constantly. I don't even get lunch. How many times I have left and not even peed all night long.
The door's locked and they keep on knocking.
Yes.
Yeah.
I mean, seriously?
And there's some bathrooms you don't want to walk into. I won't spend time in it.
Like, wait a minute, the last turd's coming out now. Hang on.
Melody, we hope you get that massage envy this week.
Oh,
Okay.
I will. Thank you.
Okay. Okay, Sue, what about you?
Well, I didn't put it in the chat, but a good thing for me today is this class. I always look forward to it and enjoy everything that is taught. Oh, Melody, you need to come to a contract in California. I'm so sorry. We have ratios and I think a little better pay. I had a couple questions, Miss Karen. Who's doing the Portuguese Camino? You mentioned a name.
My husband, Greg, the one who lectured to you all about heart math.
Oh my gosh.
Yeah, he is.
Oh,
Yeah.
that's on a bucket list in this household too.
Awesome. Well, we'll share everything that he learns and I will learn too about it. So,
are you going to do part of it?
I have tendonitis in my foot and I had to have physical therapy. So I'm up to 6 miles, but tomorrow he's doing 14 miles and I can't do that yet. So
okay.
Observe him walk.
Oh, and then another question, is an ASN an associate degree nurse?
Yeah.
Okay, because they're ADNs out here. So that's why I wasn't completely sure. So is it the American Holistic Nurses Association that can provide a nurse coaching test?
Yes.
Okay.
Oh, who do you think, Mary? Who are you talking about?
If you want to take the exam for the certification, board certification as a nurse coach or holistic nurse, you're going to go through the American Holistic
Nurses Credentialing Center, right?
Okay.
Right.
Okay. Great. Okay. Thank you.
And
so those are my takeaways. Things to learn.
So maybe next time, I'll type in the chat those websites. And Chelsea, if you want to reach out to me to, talk about the certification exam, because I took it in August, I'm happy to, give you any pointers or whatever. Okay.
Thank you, Mary.
Can I be on that call?
Yeah, and are there specific requirements before taking it?
Yes, you have to do a program. I don't want to take up time. Maybe we could do a separate Zoom call on that. I have Zoom, so I can set it up. Just I just need
That'd be
to
great.
get
Mhm.
more info. Is our Karen and Mark, are our emails shared somewhere so that we can reach out to each other?
Oh, we haven't shared emails, but we can share emails. Would you all like? Is there anyone that does not want their email shared? Let's ask it that way. Okay, goody. Well, then we'll share them with you.
All right.
I'll send out a list and you can have them, and then you can contact everyone. So that's great.
And
That's
then
great.
Mary, I'll add it to the Pathright system. There's a slide at the beginning called contacts.
Oh,
And
great.
to your inquiry, it hasn't been updated yet with everybody's email address. So it will be in there as well. So that, thank you for reminding us and giving permission to collaborate with folks. And that actually is my takeaway as well. So thank you, Sandra, Monique, Chelsea, Marcia. You're in the Pathright system, reviewing content down at the bottom. There's complete step next that triggers just a monitoring that we know that you're going through this. You know, as we approach the end of this class, the last thing you want to do is try and scramble back and try and consume a lot of content. So it's ideal that if you can moderate yourself with your schedule and reviewing the content, you know, if you need to review a YouTube video too, that's embedded in Pathright, YouTube has some great controls where if you click the right button, you can jump 10 seconds in a YouTube video. So you can repeatedly, quickly buzz through a minute or two, you know, if you want to skip over a certain portion of that content. The other thing I want to say, Karen and I constantly bring up the Osher Lifelong Learning Institute, and one of my healing network has been a retired state senator that I met. I'll be the first to tell you that I failed history in high school, and I hated politics and still hate politics. But what I've learned is as we get older, until you speak up to these politicians and share your stories, they are the decision makers for North Carolina going to Raleigh and to Washington. If they don't hear your heartfelt stories, they're not armed with change management tools that are necessary for the healthcare industry. So my summary statement is we're at that time of year where there are politicians out there. And when you're taking your journey and you happen to be standing next to one, be prepared with that 30-second, 1 minute plug to say, hey, this country needs some major changes, and this is what I feel you should hear to work towards.
Well, thank you, Mark. Thank you. And Sandy, what about your takeaway?
Well, listening to the hospital horror stories, I was just reminded of something. had been working so long, and then the kids were grown, and I took a travel assignment to Nevada and ICU. And the third day, you know, supervisor came around, and I said, "Is there something wrong?" She said, "Well, I came to relieve you so you could take a break." And then I realized I had never had one. But I thank you for the Medicare Advantage things. It's been something that is being done. We're being ripped off. It's very hard to get people to understand about that until they go. So as long as people are very, very healthy, it does work out for them. But as soon as they have any kind of medical issues, all of a sudden they have huge copays, things are not approved, and it delays everything for their care. So the top 6 are, even in these times right now, the top 6 companies have made their biggest profits ever. And I watched the fraud things like Karen. Well, I don't know, Karen, I might send you one of the ones I follow. And they are starting to prosecute and They are making headway. It's been going on for very quietly for about 6 years now, but they are getting them. So a little at a time. So as far as relaxation, I bought some earplugs. Because I can hear, like last night, I know this is gonna sound funny. We use a timer for our coffee maker. And we were going to bed and the door was closed, the kitchen's on the other side of the house. And I told my husband, I think the coffee maker just came on. And he said, how could you hear that? I said, maybe you should check it. And sure enough, it was on. I can hear. And so I bought some earplugs and I did sleep a little bit better last night.
Good. We're glad to hear that. All righty. So,
Okay.
well, thank you, Sandy, for your for sharing and your comments. I look forward to hearing about any Medicare fraud cases that are brought up and caught.
That is daily. Because if you want a link to it, would you want it or not really?
Yes. Then maybe we can put it in Pathright so everybody else can see them too. One of the things that we are going to have is someone to come and talk about Medicare, traditional Medicare and Medicare Advantage plans. And usually I have them come at the end of the class, but I might go ahead and just bring them in sooner. So that'll be good to hear. All right.
It's a big issue.
It's huge. Anything else? Thank you all for your great sharing. And don't forget, we have 2 takeaways for next week. One of them is to find a SHIP program. And one of them is to find one stress management strategy, a coping or relaxation strategy that you will try this week, maybe just one time. See if it works for you. So it's the end of the class. So now we do this. Okay. It's good to see you guys.
Say bye.
What a face. What a face.
I know it.
Okay. Thank you.
Bye.
All right.